Now, one institution that has very publicly been on the front line of the pandemic battle is Jerusalem's Shaare Zedek Medical Center, which has treated dozens of COVID-19 patients. Of course, Jerusalem, one of the epicenters here of the disease. But some good news. Shaare Zedek, a few days ago, closed its special coronavirus ward after successfully treating its last 3 patients. All of them were either 88 or older. Well, joining us in studio, Professor Gabriel Itzbitsky, director of the Shaare Zedek Medical Center's Pulmonary Institute and an expert in internal medicine and pulmonary diseases. Gabriel, thank you for joining us. But let me ask you, tell us about this, how you were able there at Shaare Zedek to successfully treat patients. These are very elderly COVID-19 patients.
Well, just a small correction, sorry for this. We had, at the peak of the epidemic, we had about 120 corona patients hospitalized with 5 different wards and 1 intensive care unit. We still have 1 intensive care unit open and 1 corona ward. So we still have about 40 corona patients hospitalized, which is much better. Now, about the success that you're asking, it's a teamwork. It's a teamwork, basically. It's not our work. It's not the work of the pulmonologist, but everybody just. I mean, the internal medicine physicians, the pulmonologists, the technicians, the social workers, psychiatric, and everybody just gave the maximum they could. We tried to be updated during the entire period. We had, although we worked very hard and the shifts were, 12 hours, we had seminars, we had webinars, and we tried to keep on updated what are the latest medical news. And I think that the message is also that, unlike in other countries, for us in Israel, life is the most important thing, and the age is not so important, and we wouldn't refuse any treatment to anybody if he's ill from corona or any other disease because of his age. We never would dismiss the treatment because of the age of the patient. So we are doing everything we can, even if the patient is 80, 85, or 90 years old.
Right. Every life counts, of course, in these circumstances. Now, let me ask you, I was out today for the first time in almost 2 months. I took a nice long walk on the promenade in Tel Aviv, very crowded with people, several of them not wearing masks. Now that these restrictions have been eased, what are the practices, especially, that Israelis should be still careful to maintain as they go out and about?
So thank you very much for asking me this. When there was the confinement, it was easy, I would say, because everybody was, staying at home. No stores were open, so you just had to stay at home and do whatever you wanted to do. I also took a walk for the first time for a long time from my home to the hospital. This was my walk today. And I have to say that I was afraid. I was afraid because many people weren't wearing any mask. Right. And people were walking and playing and do whatever they couldn't do for the last few weeks. But the message should be that we have to be very, very careful. We have to be even much more careful than we have been before. Now that the measures are softened, we have to be very careful. The message is that everybody should wear a mask outside. We should keep social distancing. We shouldn't, give the hand and have physical contact. And we have to be very careful about this, especially with 2 groups, with the elderly population and with people with chronic diseases.
Right. And let me ask you, we hear about herd immunity, antibodies. I wonder if they're perhaps part of this, the phenomena that yours is that people are getting lulled by this talk and are perhaps not realizing how much of a threat it has. We don't even know, actually, if people who have had it can still get it again.
Okay. So I do think that that's an important point. People are listening to, obviously, TV and radio and so on, and newspapers, and every other day there is a good news, a new vaccination will come out and so on, and we found something, a new treatment. It's going to take a very long time. It's a question of months, if not more, before we'll have some vaccination, before we'll have a dedicated, real treatment of COVID, of coronavirus. So we have to be especially careful. Again, I can't say it more and more. It's so important now because we are very afraid about the second wave to come. The question is, when will it come? Will it be here in a few weeks? Will it be here, the second wave, only next December or January? I don't know, but most probably it will come back.
Well, let's hope when it does, it is certainly at a lesser intensity than presently. But thank you, Professor Gabriel Spitsky of Shaare Zedek Medical Center, for joining us.
My pleasure.
On I-24 News.